The ICU monitor flatlined at 2:47 a.m., and nobody noticed except the man holding cold coffee outside the glass. Preston Walsh wasn't supposed to be there. Not in that hallway. Not watching the cardiac team scramble around the dying CEO. Definitely not recognizing the subtle pattern on her EKG that every doctor in that room was missing. The same pattern he'd seen 3 years ago, right before he walked away from medicine forever. His hands trembled, not from fear, but from muscle memory. Behind him, through another glass window, his 7-year-old son slept in a hospital bed, pale and small under white sheets. Finn needed him. Finn always needed him. But across this hallway, a woman he'd never met was dying from a misdiagnosis that would kill her in less than 2 hours. And Preston Walsh, former cardiac surgeon, current medical transcriptionist, the man who gave up his license after one fatal mistake, was the only person in this building who knew how to save her. He wasn't a doctor anymore. He had no right to interfere, no authority, no second chances. But he knew exactly what would happen if he stayed silent. What happens when the only person who can save a life is the one person who's forbidden to try. Preston Walsh had learned to live in the spaces between beeps. The rhythm of hospital monitors had become the soundtrack of his existence. Not in operating rooms anymore, but in pediatric oncology wards where his son spent every third week. He sat in the vinyl recliner beside Finn's bed, laptop balanced on his knees, transcribing cardiac surgery reports for doctors who still got to hold scalpels. 3 years ago, surgeons transcribed his reports. Now, he transcribed theirs at 1.3 cents per word. It paid for Finn's copays and kept them in their small apartment in North Charleston. Finn stirred in his sleep, small hand clutching the stuffed elephant named Herbert. 7 years old with acute lymphoblastic leukemia, dark hair thinned by chemo, gray eyes shadowed by sickness. Preston's ex-wife had left when the medical bills mounted, when it became clear that treatment would be measured in years, not months. Preston watched his son's chest rise and fall, counting breaths the way he used to count sutures. Muscle memory was a cruel gift. It let you remember everything you'd lost. He stood, needing to move. The hallway outside was dimmer, nighttime lighting for sleeping patients. Preston walked toward the vending machines, coffee cup in hand, though the liquid had gone cold. The cardiology wing was on the way, his old territory, back when he was Dr. Preston Walsh instead of just Preston. The ICU occupied the corner of the second floor, glass-walled rooms arranged around a central nursing station. Preston walked past like a ghost, unseen. Then he saw the crowd in room 7. 4 doctors, 3 nurses, equipment carts blocking the doorway. Someone was dying, and the team was fighting to stop it. Preston should have kept walking. Instead, he stopped, looked through the glass, saw the woman on the bed, saw the monitors, saw the pattern. His coffee cup hit the floor. He was staring at the EKG monitor, at the specific rhythm displayed there, at the elevation pattern that every doctor in that room was misreading. They thought it was a heart attack. They were treating it like a heart attack, which meant they were killing her. Preston's hands moved toward the door before rational thought caught up. He wasn't a doctor anymore. Couldn't walk into that room. Couldn't override their treatment. Could only watch a woman die from a misdiagnosis that he, and apparently only he, could see. The lead physician inside was Dr. Raymond Hayes, chief of cardiology 3 years ago when Preston's career ended. Raymond had sat across from him in the ethics hearing as they reviewed Preston's fatal mistake. A patient named Gerald Hoffman, 62 years old, who died on Preston's table because Preston had been too confident, too certain. The autopsy revealed a rare condition Preston should have caught. Raymond had suggested Preston surrender his license voluntarily rather than face formal revocation. Preston had agreed. A man had died because of his arrogance. Giving up medicine seemed like the only honorable choice. Now Raymond was making the same kind of mistake. missing the signs that pointed to something other than the obvious diagnosis. This wasn't acute coronary syndrome. This was Takotsubo cardiomyopathy, broken heart syndrome, complicated by a pheochromocytoma, a tumor dumping catecholamines into her bloodstream, mimicking cardiac symptoms. Treat it like a standard heart attack with beta blockers and she'd die. She had maybe 2 hours. Preston pressed his palm against the glass. Inside, Raymond gave orders with confidence, every action making the situation worse. Preston pulled out his phone, calling a number he hadn't used in 3 years. Dr. Hayes' office. If this is a medical emergency, Preston cut her off. This is Preston Walsh. Get Dr. Hayes out of room 7 in the cardiac ICU immediately. Tell him it's life or death. Tell him what he's looking at isn't ACS. It's Takotsubo with pheochromocytoma. Tell him to check for pheochromocytoma before he gives beta blockers. The operator hesitated. Sir, I can't interrupt. Preston's voice cracked. That patient will die in 2 hours if someone doesn't listen to me. Please. There was a long pause. Hold please, Mr. Walsh. 3 minutes passed. Then Raymond pulled out his phone, reading something on the screen. His expression changed, doubt flickering across his face. He looked up at the monitors with fresh attention, said something to the nurse who paused the medication. Raymond stripped off his gloves and walked out, scanning the hallway until his eyes found Preston. 3 years collapsed into nothing. Raymond walked toward him with measured steps. Preston, the answering service said you called about my patient. His eyes flicked to the coffee stain on Preston's pants. You're here for Finn. Preston took a breath. I saw the monitors. Raymond, I know I have no right to, but that's not acute coronary syndrome. The ST elevation pattern is wrong. If you give her beta blockers, you're going to kill her. Raymond's jaw tightened. Preston, you're not a physician anymore. You can't diagnose patients by looking through glass walls at 2 in the morning. Preston interrupted. It's Takotsubo cardiomyopathy, broken heart syndrome, plus pheochromocytoma driving the catecholamine surge. Check her metanephrines. Get a CT of her adrenals. Beta blockers will be contraindicated. Raymond glanced back at his patient. You really think you see something we missed? Preston met his eyes. I know I see something you missed, the same way I missed what Gerald Hoffman actually had. I'm not making that mistake again, and I'm not letting you make it either. Raymond was quiet, studying Preston's face. Tell me what you see, specifically. Preston pointed at the monitors. Look at the ST elevations. Circumferential pattern, not following coronary distribution, affecting anterior, lateral, and inferior wall simultaneously. Classic Takotsubo. And her blood pressure is labile, spiking and dropping with episodic catecholamine release, not ischemic injury. She came in during a board meeting. High stress. You need an echo to see the apical ballooning, and check for secondary causes. Raymond was listening now, eyes moving between Preston and the monitors. But the troponin, Preston nodded. Elevated in Takotsubo too, not specific to MI. You know I'm right. That's why you came out here. Raymond stood very still, processing. Around them, the hospital breathed its nighttime rhythm. Finally, he spoke. If you're wrong, if I change the protocol and you're wrong, she could die. Preston said quietly, if you don't change it, she will die. 90 minutes before the stunning becomes irreversible. I've been transcribing cardiac reports for 3 years, Raymond. Every day. I know every pattern. I might not be allowed to practice, but I haven't stopped thinking like a physician. I can't. Raymond looked at him for another long moment, then turned and walked back toward the ICU, pulling out his phone. Preston sagged against the wall, exhausted. He'd done what he could. The rest was up to Raymond. He watched through the glass as Raymond spoke urgently to his team, as a nurse pulled up something on a computer, ordering the echo and labs. They disconnected the IV line with beta blockers. The activity changed character. Less rushing, more thinking. Preston allowed himself a breath of relief. His phone buzzed. Finn woke up asking for you. Everything okay? Preston typed back. On my way. 2 minutes. He took one last look at the woman whose name he didn't know, whose life he might have just saved, then walked back toward his son. Finn was sitting up when Preston returned, Herbert clutched in his lap. Hey, buddy, Preston said softly, settling into the recliner. Just went to get coffee. Finn's voice was small. I had a bad dream. Preston took his son's hand, so small and thin. Want to tell me about it? Finn shook his head. Already drifting back. Just wanted to make sure you were here. Preston felt something crack inside his chest. I'm always here, Finn. Always. He stayed awake the rest of the night watching his son breathe. Some things mattered more than sleep. Morning came with pale light. Finn woke groggy but stable, managed half a bowl of oatmeal before nausea hit. Preston held the basin, rubbed circles on his back, murmured reassurances. This was their routine. Dr. Helena Mercer made rounds at 8, checking labs. Counts are holding steady. If things stay stable, we can send you home tomorrow. She smiled at Finn. Think you can stay out of trouble that long? Finn managed a weak smile. Maybe. Helena ruffled his hair and turned to Preston. You look exhausted. When's the last time you slept? Preston shrugged. I sleep. She didn't believe him but let it go. Preston was cleaning up breakfast when his phone rang. Unknown number. Hello? Preston Walsh, this is Amanda Reeves, calling on behalf of Veronica Ashford. Miss Ashford was the patient in the ICU last night. She wanted me to thank you for your intervention. Preston looked at Finn, dozing again. Did they? Amanda's voice warmed. She's stable. Echocardiogram confirmed Takotsubo. CT found a 3-centimeter pheochromocytoma. They're scheduling surgery this afternoon. Dr. Hayes said if you hadn't caught it. She paused. Miss Ashford wants to meet you, if you're willing. Preston found himself agreeing, getting the room number. When he hung up, Finn's eyes were open. Who was that, Dad? Preston smoothed the blanket. Someone I helped last night. She wants to say thank you. Finn smiled. You're good at helping people. Preston's throat tightened. If only that were true. Room 7 looked different in daylight, less dramatic. The woman in the bed was younger than expected, mid-40s, dark hair pulled back, eyes that tracked his entrance with sharp focus. Mr. Walsh, Veronica Ashford said, voice stronger than anticipated. Please, come in. Preston approached, aware of his rumpled appearance. Miss Ashford, I'm glad you're better. Veronica studied him intensely. Dr. Hayes told me everything. How you saw something an entire team missed. How you called in despite having no official capacity. How you risked looking foolish to save a stranger. She paused. He also told me you used to be a surgeon. That you gave up your license 3 years ago. Preston shifted uncomfortably. I made a mistake. A patient died. Giving up medicine was the right thing to do. Veronica tilted her head. Was it? Because from where I'm lying, if you'd truly given up medicine, I'd be dead right now. The words hit hard. I don't have a license. Without that, what I think doesn't matter. Veronica's voice sharpened. Can't save lives? You managed that just fine last night. She shifted in bed, wincing. Amanda did research on you. Found out about your son. The leukemia. I also own Ashford Biomedical. We specialize in oncology research. Preston's breath caught. The clinical trial, the one Finn's on. Veronica nodded. I started that initiative 5 years ago, after I lost my daughter to leukemia. She was 8. Same age as your son now. The information reordered Preston's understanding. This woman had created the treatment keeping Finn alive. I didn't know. When I saw your monitors, I had no idea who you were. I just couldn't let it happen again. Veronica's eyes were bright with emotion. That's exactly why I wanted to meet you. You helped anyway. Not because of who I am, but because you're still a doctor, where it counts. In here. She tapped her chest. The license is just paper. The oath, the knowledge, the instinct that made you speak up. That's what makes you a physician. Preston felt something shift inside him. I killed a man, Gerald Hoffman, 62. I was so sure I knew what was wrong that I didn't question myself. He died because of my arrogance. Veronica was quiet, then spoke gently. Did you learn from it? Preston looked up, startled. What? She repeated. Did you learn? Did it change how you think about medicine, about the danger of certainty? Preston thought about 3 years of transcribing reports, recognizing patterns, learning to question. Yes, I learned. Veronica smiled sadly. Then Gerald Hoffman's death wasn't meaningless. It taught you humility, made you the kind of doctor who could see what others missed. I lost my daughter because her oncologist missed early warnings, dismissed my concerns as parental anxiety. That doctor still practices, still has his license, never admitted he was wrong. Her voice hardened. You gave up everything for one mistake. Tell me, which one of you practices with integrity? Preston didn't have an answer. Veronica softened. I'm not saying your mistake didn't matter. I'm saying maybe you've punished yourself enough. Maybe medicine needs doctors who've learned what arrogance costs. They sat in silence, monitors beeping. Preston finally asked, What happens now, with the tumor? Veronica shifted, businesslike. Surgery this afternoon, laparoscopic removal. The Takotsubo should resolve once catecholamines are controlled. She met his eyes. I'll be fine, thanks to you. Preston stood to leave, but Veronica stopped him. She pulled out her phone. Amanda, set up a medical fund. Full coverage for pediatric oncology patients whose families struggle with treatment costs. Start with families here at Medical Center of Charleston. Preston started to protest. Miss Ashford, she cut him off with a look. I'm not doing this for you. I'm doing it because I can and should have years ago. Consider it payment if that helps. You saved my life. Letting you worry about bills seems like poor gratitude. Preston felt emotion behind his eyes. Thank you. Veronica waved dismissively. Thank Amanda. She does all the work. Her eyes warmed. Go take care of your son, Preston, and think about what I said. About medicine, about second chances. Preston left feeling lighter than he had in 3 years, like some weight had shifted enough to let him breathe. Finn was awake when he returned, coloring. Dad, where were you? Preston settled into the recliner. Visiting that lady, the one I helped. Finn's eyes went wide. Was she nice? Did she say thank you? Preston laughed, the sound genuine. Yes, she said thank you. And she's going to help other kids like you. Kids whose families worry about paying for medicine. Finn considered this seriously. That's good. Some kids here, their parents look really worried, like you sometimes. Preston's smile faded. Do I look worried a lot? Finn shrugged. Sometimes. But it's okay. I'm not scared when you're here. The simple trust hit Preston hard. I love you, Finn, more than anything. Finn smiled, returning to his coloring. I know, Dad. Love you too. They spent the day in comfortable routine. Preston read aloud while Finn drifted in and out of sleep. The afternoon chemo went smoothly. By evening, Preston pulled out his laptop thinking he should work, but his mind kept drifting to Veronica's words, about second chances, about the license being just paper. His phone buzzed. Raymond Hayes. Can you come by my office tomorrow morning? 9 a.m.? Need to discuss something. Preston stared at the message, anxiety and curiosity mixing. He texted back, I'll be there. The rest of the evening passed quietly. Finn fell asleep early. Preston sat watching his son breathe, thinking about how life surprised you. Yesterday, he'd been a washed-up surgeon. Tonight, he was somehow different, like he'd taken a step in some direction he couldn't quite see yet. Raymond Hayes' office looked exactly as Preston remembered. Journals stacked everywhere, diplomas covering one wall. Raymond sat behind his desk, reading glasses on, looking older, but still carrying that air of authority. He looked up when Preston entered, gestured to the chair. "Preston, thank you for coming." Preston sat, aware of his undefined position here. "You wanted to see me?" Raymond removed his glasses. "Veronica Ashford's surgery went well. Tumor removed. No complications. Her cardiac function is improving. She'll make a full recovery." He paused. "Because you saw something I missed," Preston shifted. "You would have figured it out." "No," Raymond interrupted firmly. "I wouldn't have. Or it would have been too late. I was convinced of my diagnosis. Classic diagnostic closure. Exactly what we warn about. Exactly what I failed to avoid." He leaned forward. "You saved her life, Preston." Raymond's tone shifted. "I've been thinking about Gerald Hoffman, about your decision to surrender your license. I supported it then. But watching you last night, seeing how you've grown despite not practicing, I'm not sure anymore it was right." Preston's heart rate kicked up. "Raymond." Raymond raised a hand. "Let me finish. Medicine needs doctors who understand their own fallibility, who've learned humility the hard way, who remember that certainty can be deadly." He pulled out a folder. "I spoke with the medical board this morning. They're willing to consider reinstating your license with conditions." Preston felt the air leave the room. "Conditions?" Raymond opened the folder. "Probationary period. Supervised practice for 6 months. Mandatory peer review. Continuing education and diagnostic reasoning." He looked up. "It's not a free pass. It's a chance to earn your way back. If you want it." Did he want it? 3 years ago, giving up medicine felt like the only honorable choice, but Veronica's words echoed. "The license is just paper. I have a son, a sick son who needs me. I can't go back to 80-hour weeks and surgeries at 3 a.m. Raymond nodded. "I know, which is why I'm not offering cardiac surgery. I'm offering diagnostic medicine, consulting on complex cases, teaching residents critical thinking." He smiled. "Basically what you did last night, but officially, with regular hours so you can be there for Finn." Preston's throat tightened. "Why are you doing this?" Raymond's expression softened. "Because I've watched you stay connected to medicine even when it hurt. Watched you be a better father than most of us manage with impossible circumstances." He paused. "And because last night, you proved giving up your license didn't make you stop being a doctor. Maybe it's time we acknowledge that." Preston sat still, feeling the weight of decision. This was a gift he never expected. But taking it meant risking failure again. Meant trusting himself after believing he couldn't be trusted. "I need to think about it." Raymond nodded, unsurprised. "Take your time. 30 days. Talk to Finn. But Preston, don't let fear decide. Don't let Gerald Hoffman convince you that one mistake defines your career. Medicine is hard. We all fail sometimes. The question isn't whether you'll make another mistake. You will. The question is whether you've learned to fail better." Preston left with the folder in hand, mind spinning. Finn was awake when he returned, excited. "Dad, Ruth said maybe we can go home tomorrow." Preston managed a smile. "That's great, buddy. How are you feeling?" They spent the day doing normal things. Preston tried to focus on his son, but his mind kept drifting to the folder, to Raymond's offer, to the possibility of becoming a doctor again. That evening, after Finn had fallen asleep, Preston opened the folder and read through the reinstatement conditions. They were fair, stringent, but not impossible. The medical board wanted to see evidence of continued learning, proof of clinical competence, demonstration that he understood what had gone wrong 3 years ago and how to prevent it from happening again. He could do this. Maybe, if he was brave enough to try. His phone buzzed with a text from an unknown number. "This is Veronica Ashford. Amanda gave me your number. Hope that's okay." Surgery went well. Doctors say I'll be released in 2 days. Preston texted back, "That's wonderful news. Glad you're recovering." A moment later, Raymond told me about his offer. "What are you going to do?" Preston stared at the question, fingers hovering over the keyboard. Finally, he typed, "I don't know. Scared of failing again." Veronica's response came quickly. "Fear is just your brain trying to keep you safe. But safe isn't always the same as right." Then another message. My daughter's name was Olivia. She loved butterflies and hated broccoli and wanted to be a veterinarian when she grew up. She died because a doctor was too arrogant to admit he might be wrong. You're not that doctor, Preston. You're the doctor who learned from his mistakes. Medicine needs more doctors like you, not fewer. Preston read the messages 3 times, feeling something shift in his chest. Maybe she was right. Maybe the worst thing he could do, worse even than the mistake that killed Gerald Hoffman, was to let fear keep him from helping people he could save. He looked at Finn, sleeping peacefully, chest rising and falling with mechanical regularity. This child was alive because of medicine, because of research Veronica had funded, because of doctors who showed up every day despite the terrible weight of responsibility they carried. Preston had spent 3 years running from that responsibility. Maybe it was time to carry it again. He picked up his phone and texted Raymond, "I'll do it. I'll take the reinstatement." The response came almost immediately. "Good. We'll start the paperwork tomorrow." "Welcome back, Dr. Walsh." Preston set the phone down, feeling the title settle over him like an old coat he'd forgotten he owned. Dr. Walsh. He'd thought he'd never hear those words again, thought he'd lost the right to them. But maybe Veronica was right. Maybe the license was just paper. Maybe he'd been a doctor all along, even in the darkest moments when he thought he'd lost everything that mattered. The monitors beeped their steady rhythm. Finn slept on, peaceful and unaware of the way his father's life was quietly reorganizing itself. Preston sat in the recliner, watching his son breathe, and allowed himself to feel something he hadn't felt in 3 years. Hope. The next 6 months passed in careful re-entry into medicine. Preston started in diagnostic medicine 3 weeks later, working reduced hours around Finn's schedule. He consulted on complex cases, untangled diagnostic puzzles, taught residents to question assumptions. Every decision was reviewed, humbling and necessary. Finn's treatment continued its slow progress. Some weeks were good, others brutal. But Veronica's medical fund covered costs Preston could never have managed alone. The medical board review came at 6 months' end. Preston presented his cases, answered questions about how Gerald Hoffman's tragedy reshaped his approach. The lead board member, Dr. Patricia Chen, spoke with careful formality. "Dr. Walsh, you've demonstrated exemplary clinical performance and outstanding teaching. Most importantly, you've shown humility and self-awareness that makes you a stronger physician than before." She paused. "We are reinstating your medical license without restrictions, effective immediately. Welcome back, Dr. Walsh." Preston felt tears prick his eyes. He'd done it, earned his way back. When he told Finn that evening, the boy's face lit up. "Does this mean you're a doctor again? Like a real doctor?" Preston laughed, pulling his son into a hug. "Yeah, buddy, like a real doctor." Finn hugged back, arms surprisingly strong. "I knew you would be. You're good at helping people." Preston held his son close and allowed himself to believe it might be true. Maybe he was good at helping people, even in moments when he couldn't see past failure. Maybe that was what second chances meant, learning to carry the past forward without letting it crush you. 8 months after that night in the hospital hallway, Preston stood in the teaching auditorium, looking out at 30 residents waiting for his lecture on diagnostic reasoning. Raymond sat in the back with an encouraging smile. Preston clicked to his first slide showing Gerald Hoffman, smiling, alive, unaware his death would become a teaching moment. 3 years ago, Preston began steadily. I made a mistake that killed this man. I was certain of my diagnosis. I was also completely wrong. He told them the whole story, the missed symptoms. The diagnostic closure, the autopsy moment when truth became unavoidable. He didn't spare himself. The residents listened, recognizing this could be them. That certainty was seductive and deadly. I gave up medicine after Gerald Hoffman died, but 3 years later, standing in a hallway at 2 a.m., I saw a patient dying from exactly the kind of mistake I'd made, and I had a choice: stay silent and safe, or speak up and risk everything. He spent the hour walking them through the case, explaining subtle findings, differentiating Takotsubo from acute coronary syndrome. The residents asked challenging questions that showed critical thinking. When the lecture ended, several approached. One young resident named Amy lingered. "Dr. Walsh, how did you know you were ready to come back? How did you trust yourself again?" Preston thought about the question. "Honestly, I'm not sure I do trust myself completely, not the way I did before. But I think that's better. Medicine requires confidence, but also doubt. The trick is holding both at once. Acting decisively while remaining open to being wrong. It's uncomfortable, but it's honest." Amy nodded slowly. "Thank you for sharing your story. Most attendings pretend they never make mistakes." Preston smiled. "We all make mistakes. The question is what we learn from them." After Amy left, Raymond approached. "That was excellent. Exactly what these residents need." He paused. "The hospital board is creating a new position, Director of Diagnostic Safety. Someone to review complex cases, provide second opinions, help prevent diagnostic errors." "They want you." Preston felt the weight of the offer, a position created to prevent other Gerald Hoffmans. Fitting, in a way, turning his worst failure into his life's mission. "I'll need reduced hours. Finn still needs me." Raymond nodded. "Already accounted for. Flexible scheduling, consulting, oversight, teaching." Preston looked out at the empty auditorium, thinking about residents learning to avoid tragedy, about Veronica turning her daughter's death into research saving children like Finn, about Gerald Hoffman's family, whose tragedy might prevent others. "Okay, I'll do it." 6 months later, Preston stood with Rebecca Hoffman, Gerald's daughter, now a medical student, co-presenting their case to a packed auditorium. She'd asked to tell the story from both sides. At their first meeting, she'd hugged him and said, "I forgive you. I forgave you long ago. Now you need to forgive yourself." They spoke about Gerald, his life, the hole his death left. Then Preston walked through the medical details, the cascade of decisions leading to catastrophic failure. He didn't soften anything. "My father's death was a tragedy," Rebecca said at the end, "but it doesn't have to be meaningless. If his case teaches even one future doctor to practice with humility, then something good came from something terrible. That doesn't erase the loss, but it gives it purpose." The auditorium was silent, many students with tears on their faces. A student asked, "Do you ever think about quitting again?" Preston considered carefully. "Sometimes. But then, I think about the patients I've helped since coming back. The diagnostic errors I've caught. I can't bring Gerald Hoffman back. But I can honor his memory by being the doctor I should have been for him. Careful, humble, always questioning. That's transformation. And transformation is the best we can do with our failures." Students lined up afterward to thank them. share their own fears about making mistakes. Rebecca turned to Preston with tears. "Thank you for doing this with me, for not hiding." Preston shook his head. "Thank you for forgiving me when I didn't deserve it." Rebecca smiled. "You deserve forgiveness. My father was a teacher. He believed in second chances, in learning from mistakes. He'd be proud that his death led to you becoming a better physician. Led to this program, helping so many others." They stood together, two people connected by tragedy, and Preston felt the weight he'd carried shift. It didn't disappear. Probably never would. But it changed character, became something he could carry without being crushed. That evening, Preston returned home to find Finn waiting up, excited. "Dad, Dr. Helena called. My counts are in remission. She said if they stay good for 6 more months, I might be done with treatment." Preston felt joy and disbelief flood through him. Remission, the word they'd chased for 2.5 years. "Are you sure?" Finn nodded vigorously. "She said my bone marrow biopsy was clear. I'm doing really good." Preston pulled his son into his arms, holding tight, letting himself believe they might actually survive this. That Finn might grow up, might become that paleontologist, might have a normal life. "I'm so proud of you, buddy. You were so brave." Finn hugged back, arms strong. "We both were, Dad. We both fought." And he was right. Preston carried Finn to bed, tucked him in with Herbert. "Dad?" Finn's voice was sleepy. "Yeah, buddy?" A pause, then softly. "I'm glad you're a doctor again. I'm glad you help people. It makes you happy." Preston felt tears slide down his face. "You know what makes me happiest? Being your dad. Everything else is just extra." Finn smiled in the darkness, squeezed Preston's hand, and drifted off. Preston sat watching his son sleep, thinking about all the ways life surprised you, all the doors that closed and opened, all the ways failure could transform if you were willing to do the hard work. He thought about Gerald Hoffman and Veronica and Rebecca offering forgiveness he never expected, about Raymond giving him a second chance, about Finn teaching him courage meant acting despite fear. 3 years ago, Preston had been a broken man who thought his story was over. Now he was something else, a father, a teacher, a doctor who understood fallibility and practiced with humility. The journey had been brutal, but listening to Finn's steady breathing that promised life and hope and tomorrows, Preston wouldn't change any of it. Not the mistake that destroyed his career. Not the exile. Not the hallway at 2 a.m. where he chose to speak up. All of it, every painful, transformative moment, led him here. To remission and redemption and the quiet grace of second chances. Tomorrow, he'd review difficult cases, teach residents about humility. But tonight, he was just a man grateful to be alive, grateful to be present, grateful for the gift of trying again. Some mistakes you carried forever. But if you were brave enough to keep showing up, keep learning, keep growing, those mistakes could become the foundation for something better, not erasure, transformation. And transformation, Preston had learned, was everything.